Mobility. With the musculoskeletal system, this is grouping of tissues that are vital for stability and proper body functioning. Think about muscles, bones, joints, tendons, cartilage, and ligaments. Tendons and ligaments connect muscles and bones, and synovial joints enable motion and flexibility between the bones. Muscles have various functions. The main function for them is movement. Other functions include posture and positioning, and generating heat. The skeletal or the bones, they also have various functions. To support, enable a solid, stable framework, to protect the vital internal organs, to produce bone marrow in the center of the bones, where the red blood cells, white blood cells, the platelets, and the macrophages are produced. The bones are a storage system for calcium, phosphorus, magnesium, iron, and lipids. The bones are used for movement because they work with the muscular attachments to create motion. Nerve fibers communicate with the muscle and the sensory receptors through neurotransmitters or chemical signals. Muscle movement is under conscious control, but the brain coordinates the action of the muscle movement. Proprioception is one's self-awareness of body positioning. Proprioception enables the body to coordinate, balance, fine-tune the positioning and the movement. Body mechanics describe the way an individual uses the body to sit, stand, lift, carry, bend, or rest or lie in a resting position. Optimal posture supports the spine, the muscles, and joints. This helps to increase strength, decrease fatigue, and energy use. The center of gravity is a central point of weight for the body. When one is standing, there is an imaginary line for the center of gravity that runs horizontally below the umbilicus and intersecting the line of gravity. Ergonomics is the study of body mechanics related to the demand and the design of the work environment that considers all the equipment that is used. Ergonomics focuses on designing, adjusting, and arranging items so that an individual may work safely and efficiently. The musculoskeletal system, the bones, muscles, and joints require motion to remain healthy. Immobility will lead to changes in the structure and function of the musculoskeletal system. Bed rest for as little as a week, 1 week, can have a drastic effect on the ability of an individual to move and perform their activities of daily living. The cardiovascular system, prolonged immobility causes severe alterations. In 24 hours of total bed rest, the body fluids routinely will present in the lower extremities. These will be redistributed to the head, abdomen, and chest because of the change in the gravitational force. This increases the blood volume returning to the heart and signals the body to release hormones to regulate the body fluid balance. The result is diuresis and dehydration that will cause a lowered circulating blood volume and an increase in the viscosity or the thickness of blood. The decreased circulating blood volume will cause a decrease in the amount of blood that is ejected with each heart contraction. This lowered demand causes atrophy of the heart muscle, known as cardiac deconditioning. With the respiratory system, immobility reduces the amount of air that is exchanged, and it increases the risk of infection. Supine position impairs the ability of the rib cage to expand appropriately because it causes physical restriction by the bed. The abdominal organs will shift toward the diaphragm, and this will decrease the depth of the breaths and the effectiveness of coughing. The gastrointestinal system uses gravity to move food from the mouth to the rectum. Supine position causes decreased appetite and food intake for the client. The muscle activity will slow, and the absorption of protein from the gastrointestinal tract will decrease. This will cause a lower level of blood proteins. The genitourinary system, here gravity enhances drainage of urine from the kidneys and the collection in the lower portion of the bladder. The gravity also exerts pressure on the abdominal organs to enhance the bladder's sensation to void. For the integumentary system, supine position permits a large portion of the skin to remain in continuous contact with the bed and makes a risk for altered skin integrity. Prolonged pressure compresses the skin and the tissue between the bone and the surface of the bed. This will restrict the blood flow. Think about bony prominence areas, shoulders, back of the head, the occiput, the sacrum, the tailbone. Psychologically, immobility causes an increased dependence on another individual for activities of daily living. It can also cause the client to feel a loss of privacy, an inability to participate in activities. It negatively can impact their self-concept and their self-esteem. This may lead to frustration, anxiety, and depression. Activity intolerance can cause a functional decline for the individual. Physical inactivity will lead to the loss of the ability to perform many tasks. Activities of daily living would be an example. This decline is due to many factors: prolonged bed rest, a decrease in mobility, balance, weakness from hospitalization or an illness. Activities of daily living are the basic essential skills an individual does independently every day that are related to personal care. This would include dressing oneself, bathing oneself, toileting, and feeding oneself. Balance and posture and alignment will influence the level of mobility. Appropriate body alignment enhances posture and creates a stable center of gravity improves balance, decreases the risks of falls and injuries. Appropriate posture and alignment will also minimize the risk of musculoskeletal strain. When a nurse is performing a mobility assessment, the nurse needs to consider the client's normal mobility status, the ability to sit, the ability to stand, the ability to walk or be mobile. Does the client use or need assistance? The amount of degree of mobility and immobility, the condition of the client's skin, and the presence of any manifestations that happen during an activity. Mobility assessments need to consider an individual's age and developmental level. As individuals age in life, many individuals may have a difficult time with mobility due to body alignment and the gravitational pull. Ambulation improves muscle and joint strength. It prevents the complications of immobility. It decreases the length of hospital stay. Remember, older adults are more prone to easily losing mobility and function. Ambulation also increases an individual's sense of well-being and independence. A gait belt is a wide, strong belt that permits assistance with stability. This is placed firmly at the waist to be used by an assistant. A cane can increase stability and improve gait mechanics. Canes can be single point or 4-point, known as a quad cane. This will offer a broader base of support. A walker provides a wide, stable base for an individual. A standard walker has no wheels and provides the greatest amount of support. Crutches are used by individuals that have appropriate upper body strength that is required to use crutches. Positioning is intentionally placing a body in a specific manner. Proper positioning is the aligning of the body in neutral position that supports the natural curves, eliminates pressure points, hyperextension, or lateral rotation. The goals for positioning and alignment are to promote and prevent a decrease of injury. Promotion for the goal is comfort and safety, dignity and privacy, participation in activities, and frequent position changes. The prevention is to prevent strain, injury, or skin breakdown. Range of motion is the manipulation of a joint within its normal flexion and extension. Range of motion benefits include increased joint functioning and flexibility, improved posture, reduced stiffness, and a decreased risk of injury. Range of motion may be active or passive. Passive range of motion is movement of a joint by another individual without the client's assistance. With passive range of motion, muscles and joints are completely relaxed, while external motion and forces move the body part. For active range of motion, this is a voluntary movement of a joint by a client without any form of assistance. The current recommendations are for an adult to engage in moderate intensity aerobic activities, minimally 150 minutes a week. This would be 30 minutes per day at 5 days per week.